Okay, let's replace pain with accuracy. I think that's it. Oh, get the punch exactly. Well, what do I like about this instrument? Well, like the IOLMaster 500, we get a lot of things simultaneously, but here we get actually more things. We get the axial length decay, central corneal thickness, anterior chamber depth, lens thickness, zodiac sign, mother's maiden name, favorite dessert, and shoe size. Okay, and the Ks. The Ks are absolutely sublime with this, and we're going to go into that in a little bit more detail. It's something new. Anterior chamber depth is not an estimation by slit image. It's an actual measurement by optical biometry, and also the lens thickness is by optical biometry. The newer generation formulas like Holiday 2, like Olsen, some of the ray tracing technologies require that. You have a lot of measurement flexibility. The computer and the instrument are completely separate. In fact, the instrument is just connected by a USB cable. Also, all of these measurements can be individually accessed and validated by the user, so you can tell exactly if you have something right. So rather than just getting numbers that you're given, you can actually go in, move calipers, and get everything exactly where you want it to be. And as I mentioned, the computer and the instrument are separate. This not only has the Holiday 2 formula, but it also has the entire Holiday IOL consultant, plus access to any program you want to add, like the Olsen formula, perhaps some of the ray tracing technology. So instead of just having one part of the Holiday IOL consultant, you actually have the whole thing. And the instrument can talk to it, and it can auto-populate it. But this is what I'm going to focus on right now with keratometry. Now you get a tremendous amount of information. This is with one button push for each eye. This is what you get, and these are just the Ks right here. Okay, so we all know what this is. This is an immersion A scan, anterior cornea, posterior cornea, anterior lens capsule, posterior lens capsule, vitreoretinal interface. Well, with the LENSTAR, what it does is it gives you that information looking just like an immersion A scan. So there's your cornea, and of course you get your central corneal thickness, you get your aqueous depth, lens thickness, you get to see the interlimiting membrane and the RPE of the retina added all together, and that gives you the axial length. So it's a huge amount of information, and you have access to every single part of this. You can move the calipers wherever you want. If a little spike comes up where it's not supposed to be, you can go ahead and correct it. So here's a measurement where the operator has actually taken the electronic caliper and put it on the posterior capsule. And you can even look at individual measurements and sort those out, delete, repeat, pretty much do whatever you want. Now, one amazing piece of technology is that not only you get the lens thickness, but you actually get to view the internal anatomy of the lens. So you have the anterior lens capsule, the nuclear cortex interface, all the different things going on within the nucleus, and the posterior lens capsule. We're talking about clear structures here that are either 12 microns thick for the anterior capsule or 5 microns thick for the posterior capsule. It is actually able to image those. Now, what about using lens constants for this? Well, it turns out the optical biometry, the Ks, and the anterior chamber depth for a series of patients are pretty much the same in terms of the spherical equivalent for the Ks, also for the axial length and the ACD. So you can use LENSTAR, or rather IOLMaster, lens constants for this device as a place to start. What about prior keratofractive surgery? Well, because the Ks are basically the same, the spherical equivalent of Ks are the same all the way down to 30 or 29 diopters, you can also use the ASCRS calculator. And there's some work going on right now to have this auto-populate the ASCRS calculator for you. So there's our ASCRS calculator. And the methods that we like the most are modified Masket, Hagasel, and the Shamus method. Okay, well, let's talk about Ks. You know, what is it that makes this instrument so much better for keratometry? Well, you know, why did Willie Sutton rob banks? Because that's where the money is. Well, look where most of your Ks are. They're way down at the lower level. For the T3 through the T9, that's a little bit more than 50% of patients you're going to get. You're going to have access to in your patient population. But when you start adding the T2, that's 70% of patients are toric candidates. So you need to have some mechanism by which things can be very, very accurate. So when we do the toric IOL, we don't just get a set of Ks, we have to do two things. First, we have to figure out what are the orientation of the meridians and what are the power difference between them. Doing this with a manual keratometer can be difficult, and with the IOLMaster you can have some problems. So why does a manual keratometer work so well? And this is what the manufacturer recommends. Well, if you're off on your axis, you actually get a picture, and you get told that you're in the wrong place. When you're in the right place, you get a good picture. And so here's the steep axis, or steep meridian, the flat meridian, and what we're looking to do is just tell the power difference between to give us what we need. for the toric IOL. So with a manual keratometer, you're only measuring 4 places, but it turns out that they're the right 4 places, and it's the right information. Let's take a look at the IOLMaster. How does the IOLMaster work? What's behind the curtain? Well, here's what you have with the IOLMaster. You have 6 measurement LEDs. They're placed 60 degrees apart. So if you have a steep axis that's 30, 90, or 150 degrees, what happens is you have to do tremendous amounts of iteration in order to figure out where you are. So look at where the axes are. They're in the wrong zip code here for each of these measurement devices. Look at the the LENSTAR rather. You end up with 32 LEDs in 2 rings, and you end up with 640 measurements. So if we look at this measurement right here, you can see that the LEDs are pretty much, wherever you are, you're going to be near a measurement LED. We just, Bobby Osher, myself, Kerry Solomon just published an article in the Journal of Cataract and Refractive Surgery showing that this is probably equal to manual keratometry. So let's look at a case. This is the last patient I did before I came here for a toric IOL. So here's IOLMaster, here's LENSTAR. Quarter diopter difference, not much difference, and I hear this all the time. But look at the axis. The axis is quite different. So, why does that matter? Well, plan B for figuring out the axis is you can take an axial map, draw a line straight through the 2 lobes, and by definition, that's the steep axis. It can't be anything else. So here's the IOLMaster. We'll say 106 degrees. Well, look at 106 degrees where 106 degrees is. That's in another zip code. That's not right. And why is that? Well, let's go back a little bit here. Okay. Well, here's our meridians. You can see that the instrument has to do a fair amount of iteration. For the LENSTAR, it was pretty much exactly where it needed to be. And the LENSTAR has a lot of measurement points, so it's really not an issue. Okay, so let's actually do the calculation. So this is with the IOLMaster, and here's with the LENSTAR. With the IOLMaster, we're going to calculate for a T6, and for the IOLMaster, we're going to calculate for a T7. With the LENSTAR case, post-op day number 1 minus a quarter plus a quarter. With the IOLMaster case, we put in a T6. Just by the angular error alone, we're off by a diopter, more than a diopter and a half. By the toric IOL power, we're off by another half diopter. That's over a 2 diopter error, even though the Ks looked like they were just the same because you were off on the axis. So just in quick summary, I think the Ks on this instrument are spectacular. The axial length measurement capability is the same as the IOLMaster. The numbers come out the same. It's equivalent to manual keratometry, so this is the first validated instrument equivalent to manual keratometry that you can work with the toric IOL for, and that's what's recommended by the manufacturer. And with the measurement head and the computer being separate, you can have all sorts of companion software on the computer, just like a regular Windows 7 computer, and the instrument will talk to that, auto-populate things, and you can use all types of stuff. So that's my story, and I'm sticking to it. Thank you.